Hi, everyone. Good afternoon. And welcome to our session this afternoon, which is mental health during the COVID-19 pandemic. We're going to have a conversation. We're going to start in just a minute. We'll just wait just a couple more seconds for everyone to connect to their audio and so they can hear us. So good to see so many familiar names and faces. Hello, everyone. For those of you who don't know me, my name is Tracy Hart. I'm the CEO of the Osteogenesis Imperfecta Foundation, and welcome. So glad you're here today so we can have this wonderful session that will be led by Dr. Ayers and Dr. Michelle Fynan in just a minute. But before we start, we do have a few sort of rules of the road that we're going to talk about. And I'm going to turn it over to my colleague, Melissa Bernardi, who's the Director of Development at the OI Foundation. So Melissa, do you want to take that away?
Sure, no problem. Thanks everyone for joining us, and thank you to Dr. Ayers and Dr. Michelle Fynan for joining us today. We love having you guys. We really appreciate your expertise. As Tracy mentioned, there are a few quick rules of the road. First is remember this is not telemedicine. They are here to offer some advice, and they can certainly guide you, but this is not a telemedicine appointment. We also ask that everyone keep themselves muted this evening. This way, it cuts down on background noise, and we can all make sure to hear our presenters. If you have any questions, you can go ahead and use the chat function, and we will be keeping track of those, and we'll ask those questions for you after the presentations. Finally, we do also have closed captioning available this evening. If you click the bottom of your screen, there's a closed caption button. Just click that, and you will see the captions for the night. I think that's everything I have. Tracy, back to you.
Great. Thanks, Melissa.
Yep.
I just wanted to quickly recognize that we have several board members on the call today. So I just wanted to thank our board president, Cameron Penn is here, Ted Trahan's here, Sharon Mutnick, and I'm sorry if I've missed some of our other board members. But again, welcome everyone. So it is my privilege and honor to introduce our speakers this afternoon. Melissa keeps saying evening, and I'm going to say it's still afternoon. Dr. Ayers is the Associate Director of the University of Cincinnati Center for Excellence in Developmental Disabilities. And Dr. Michelle Fynan is online instructor at LA Film School, online coach, and therapist. And they're going to be talking with us today about topics including managing quarantine-related anxiety and advocating for our safety and health needs. So many thanks to Kara and Michelle. And Michelle, I'm going to turn it over to you.
All right. Thank you, Tracy. I'm going to share my screen. Can everyone see my slides all right here? Okay. So, as Tracy said, I am a mental health counselor, as well as a university instructor, and I'm also a person with OI. I have type 1 OI, or mild OI, and I'm a mom of 2 littles who also have OI as well. Some of you may recall our little jam session back in March when all of this first started. I spoke with Dr. Ayers during our first session about OI and mental health and COVID-19 then. And at that time we were addressing, some of the same things we'll talk about today, but some different things too, now that we're here in September, right? So we'll be talking about some additional concerns that may have popped up. So take 2, right? So I'll be talking about COVID, OI, and trauma, and how the 3 kind of are holding hands in this space right now. I'll talk about trauma response and a little bit about what can help with that and navigating those triggers that we all might be having right now and just understanding them a little bit better. And then I will be passing the torch to Dr. Ayers, who will talk about what has and hasn't changed right now. She'll talk about quarantine fatigue, which I'm right there with many of you who are experiencing that. She'll address COVID strain on relationships, and she'll also talk about COVID and kids and how to best assist our children in navigating these concerns that we're all doing ourselves as well. So I'll start by saying that this experience for those of us with OI can be very triggering of previous medical trauma that we've experienced during our online OI conference, and even in our OI group on Facebook. I've seen a lot more people lately talk about, you know, medical, like just trauma and PTSD when it comes to having OI. And is there information on medical trauma? So, you know, as someone with OI, I have been diving into this research, and I think it's important for us to understand just how trauma reacts in the body and how we can be triggered right now. And how it can even be triggering other complex or situational trauma that we've experienced in life just outside of ROI. So we often don't understand or realize really that we're being triggered because the body remembers what the mind forgets. So because of trauma, we can react to different experiences, like being home because of COVID, for example, as if the past is happening now. So our amazing brains are essentially taking information that we're getting in the present and then comparing it to our past experiences in order to figure out what's happening. So for those of us with OI, this unconscious processing might sound a little something like, hey, this whole being home all the time situation feels a lot like when I was home recovering from surgery. Or, hey, this level of anxiety that I have right now about not wanting to catch this virus feels a lot in the body like when I'm, you know, hypersensitive to everything because I'm trying to stay safe and I'm trying to avoid fracturing. So feeling stuck at home might feel the same in the body as it felt being stuck in the hospital, which is relating to that being triggered right now. Or the same as being stuck in a cast during a bad break. So these are triggers for us. So the brain is actually responding and reacting to about 10% of the present situation and then 90% to our past. And I hope that shedding some light on this and why we might be being told by family or friends like, ooh, you're really reacting like intensely right now to this, you know, feeling about everything that's going on. And I think it explains how this trauma and medical trauma that we and people with OI have experienced just because of the nature of OI and the disease itself, and what comes along with that. So a lot of people have reported to me, and that's people with OI, that, you know, I know I'm safer at home, but I'm not injured right now, but I'm still feeling so depressed, so anxious, similar to how I'm feeling when I'm home with an injury. And that could be that trauma response. Okay. So trauma kind of robs us of choice. Medical trauma we've experienced with OI, sometimes we don't have a choice about surgeries that we've experienced. We didn't choose to fracture. And in this moment with COVID, many of us are feeling like we don't have a choice about being home while others do, or they have a little bit more of a leniency. Or even when people aren't wearing masks or they're complaining about the inconvenience of wearing a mask, we might feel like they're complaining about, you know, our need for safety and our desire to be safe. So there's many layers to the feelings that we're having. And with OI and just chronic pain and medical trauma, there's dissociation from the body because our brain is amazing at protecting us. So it may assess that the body's not a safe space because of the pain that we've experienced, and it may create a block because of that. And then we're not noticing our body anymore. And research shows that when we have trauma histories, that it's more difficult for us to be able to gauge things like heart rate, because there's a disconnect with the body mind. So as someone with OI, you might be hyper attuned to your body at times. And then at other times, you may be able to completely dissociate from it in order to just go through your day to day. And, you know, sometimes going into our body may feel threatening for those of us who are, you know, using that block as a coping skill. And that's something that we do to cope with trauma. So what can we do to feel better? You know, a lot of questions came in before this presentation about like, okay, so how do I navigate this? How do I feel better? How do we overcome this depression, this anxiety, this PTSD even at times, and this dissociation from the body? And I think with education and knowledge, there comes some alleviation in those symptoms, some alleviation in those negative feelings that we're feeling, because we're preparing ourselves, right? We're getting knowledge. I know that's something that I really lean on. Also, by showing up here, you're getting that knowledge, but you're also getting support in knowing that this is, you know, we get it. We get it. And then once we realize and understand trauma through education, then we're also able to maybe put a stop to some of those negative thoughts that might be compounding the situation, because you might have been previously really judging yourself for feeling so intensely, but now there's a level of understanding of, okay, you know, this is trauma, and we're able to then reframe, and we have that choice to reframe, because again, remember, trauma robs us of that choice, right? But we do have a choice to do that. Interoception is another thing that can help. It's the act of tuning into your body and consciously feeling what's going on. And for those of us who dissociate from the body because of pain, this allows you to self-regulate your emotions. Okay, so we have to rebuild those neural pathways so that we can adjust and so that we can self-regulate our emotions better. But by doing that interoception, by going into the body, that can be triggering in and of itself. So getting support is a really important thing. Having a therapist that you can go to, that you can trust and that you feel comfortable with, so that you can start building these neural pathways back up again. Psychology Today is a really great resource where you can go in there and find someone in your network. And a lot of therapists, as we mentioned back in March, a lot of therapists are doing telemedicine. So you have that ability to access them. And again, I would just lean on the people that are in your circles, your friends, your OI family. We are all here together to provide that support. And here is my contact information. If you need any help getting support, I am happy to help and assist you in pointing you in the right direction for that. So at this point, I'd love to pass the torch to my friend, Dr. Ayers, and she can talk a little bit more about what's changed, what's new, and guide us from here.
Definitely. Thank you so much for starting us out. Trauma is such a big piece of this, and you also gave us some good places to start with the question that keeps coming to my mind in terms of, okay, what now? What helps? What should we do? So thank you so much. All right, so I'm Kara Ayers. I, like Dr. Fynan, have OI. I have type 5 OI, and pictured here, as long as my slides are showing, is me a few weeks ago with my service dog, Rocky, and he has been a great help over this quarantine period. He and I just got matched up about a month before COVID hit, so he's been a new part of my life, but one that has definitely been helpful for our whole family. So I am also a mom to 3 kids, and I'm going to reflect a little bit at the end of this in terms of some adjustment that we are trying to make from a family perspective and a child COVID perspective, which is also difficult. So as Dr. Fynan said, here we are again, right? We're still here. I am actually still here in my laundry room turned office, so not a lot has changed, it feels like, on some days since March. But in preparing for this, I really tried to think about, okay, well, what has changed? And so when I broke it down, I realized that time has changed in terms of that this is no longer a short-term challenge or a short-term response. So for me, that helps in decision making because I no longer kind of aim for this end date to this. We've pushed it back a few times, and at least for my work situation, I know that I'm working from home until the end of this year. So the time aspect has changed. I think when we last spoke in March, there was more uncertainty around like, well, we'll be back to normal in May, maybe June. So we've pushed that down the road. FOMO, I think, the fear of missing out, and honestly, the reality of missing out is a larger piece in this puzzle for me and for many others, as other people, family, friends who don't have the same risk considerations with OI and COVID have largely returned to their lives, and to watch that is really difficult and sometimes hurtful. And it's not to say that you wish they would also be missing out, but it's just a piece of kind of honest vulnerability to recognize that some of the things that I enjoy the most are things like family gatherings and spending time with our large extended family, and that has not happened for us. So that's been difficult. Although we know that safety is our top priority, that's been a hard part that has changed. What also has changed is we know a little more than we did in March. So we have much more certainty about masks, where to wear masks, when to wear masks. We know a little bit more when we follow the research about high risk activities and low risk. It doesn't always line up with what we wish may be high risk and low risk, but we do know a little bit more about that than we did in March. And another thing that has changed is divisiveness kind of across our societal sector, maybe your friends and family groups. Certainly you've observed it if you're on social media, but just kind of divided opinions have really kind of more divided in the last few months compared to March. I think there was a public campaign about togetherness and hashtag we're in this together. So this may be impacting some of your relationships, which could add another layer of this as well too. And that's not to say we feel the same about this as an OI community, but just the divide is something that impacts all of us. So what hasn't changed? The overall risks really haven't changed. I mean, I know in my community, if I look at community case counts, it's actually much worse now than it was in March. So sometimes that can feel like a strange reality shock because we were so highly attuned in March. But this is part of what the brain does when it tries to measure risk, is it tries to convince us that like it can't nearly be as serious as it was in March when all this was new and we were aware of this threat and we were just learning what we could do to stay safe. Another thing that has not changed at all is these difficult decisions. Even though I feel like I've made more decisions in the last few months than I have in my life, they still kind of keep coming. And I don't know if that, is happening in your life as well. Things like doctor's appointments that I put off a couple months ago. Now I'm really trying to consider like, well, how long am I going to put off this dental appointment or whatever it may be. And some decisions are kind of boomeranging. So I know like for my daughter's preschool, they had told us that they were not going to open. And so we had kind of taken a sigh of relief that wasn't a decision we had to make. And actually just this morning, I got an email that they've changed their mind and they are going to open, and do we want to send her? So it's these decisions that just keep kind of coming up again and again. Another thing that hasn't changed is there's still not much specific OI data, which I guess in one way we could look at on the positive side, in that there have not been this masses of people with OI that we could really look across and see how people do. And I'm not going to speak to the details of the medical side, but I know for me it's relevant to know that we can follow the same guidelines that we followed in March, in terms of that for all that I know and understand about my OI, I feel like that I would be high risk should I catch COVID. So I kind of haven't changed course. So for me, that hasn't changed. Another thing that hasn't changed is just our collective ability as a community to do hard things. As Dr. Fynan mentioned, some of these things that are coming up that are hard are also hard because they're triggering for us. But it's important to remember that we have this history of resilience as a group as well. We have this history of supporting each other. I know some of the bright spots in my quarantine period have been some, Sunday afternoon FaceTime chats with friends that we kept up over the summer, and some of those kind of things that I was more actively trying to use in my life to be resilient and keep up with my coping. I've noticed that I've let slip, and part of it was because I think for me, all of us were kind of zoomed out and FaceTimed out, so that wasn't kind of having that same social effect again. But I'm also noticing that now that I've kind of slipped on trying to fill in those pieces of my life, I'm feeling those ramifications too. So it's like this constant reassessment of your coping reserves and trying new things and recognizing that you may have to return to things and give them a break and return, and that's okay. That's part of this process. So quarantine fatigue, this slide has a picture of our poor brains. They're so tired. They are not built for this. So our brains from back in the caveman days are built for, the bear coming out of the forest and running at us, and which I always think like, oh, I wouldn't have been very high in survivability at that time anyways, but our brains are built to consider the risk for acute threats. So that's why in March, while it was a time of very high fear, it was also a time for our brains for a lot of clarity, in terms of a lot of us were taking in information and we were saying, hey, did you hear this? They said this instead. But now that we have like this long drawn out period of long-term ongoing risks, our brains have a tendency to just kind of shut it down, like, I'm done with that. And the tendency can be to kind of lower our guard, to be less cautious, almost to convince ourselves that the risks have to be less than they were. And not only could this put us at risk medically, but it's also just a very mentally exhausting experience. It's kind of like you're gaslighting yourself is what it can feel like. So one minute you feel like you've got this, you know what you have to do, it's not easy, but you're going to do it. And then the next minute you feel like, is it really that serious? Like, couldn't I just see them this one time? And so it's this constant back and forth internally. And then we're also seeing that that's happening externally in conversations with others as well. So some tips to counter quarantine fatigue, and these are taken from some researchers that are looking at this. And I find it fascinating because they've looked back at some other epidemics to give us some ideas of behaviorally, how can we kind of cope with this difficult time period. So one way is to consider taking closer looks at high risk, low risk activities. And I tend to think about what I'm missing out on if I don't, my daughter missed a sports season this season. She isn't going to participate in softball, even though it's happening right now. So for me, I'm thinking, she's missing out on that and the development of her sport. I'm missing out on seeing the parents once a week. And sometimes we forget the flip side of that is, what reward are we getting? In this case, I'm getting confidence that I'm not exposed to that many more people. So the gain is right now my health. And I have to focus on both. At the same time, I have gone for some walks in a park with a friend. We've both been masked, but for me, that is some risk, but the gain of having some in-person social contact and being outside with an adult is a gain that has been meaningful for me. So I've kind of weighed this high risk, low risk, and potential gains, and don't get trapped by the idea of like being sad about what you're missing and thinking there are no gains for missing out on something that, because of your values of your health, you have decided to avoid at this time. Reevaluate that media consumption, including social media. At different points in this, I personally have removed apps from my phone, added apps back. I've, go back and forth, give yourself grace with this, and try to remember that this will pass. There's differing opinions about when it'll pass or how it'll pass. And I'm sure that there will be, societal changes in how we think about transmission of infections, which would actually be a potentially good thing for our community. I know we're often fearful of the flu in our family as well. So if we all kind of learn some things from this, that would be great. But I think what we feel right now will pass eventually. We don't know when, but just that affirmation is helpful. COVID strain on relationships can be real, and I just wanted to share a quick tip that can be helpful is to include and practice some scripts in your life. That way you have one less decision to make. You don't have to think about exactly how to word it for your aunt or your friend who kind of out of kindness keeps inviting you to things that you may say no to. Or you may say yes to, but you have more questions like, will it be distance? Will there be masks? So I've just included one example script here that I found was helpful wording, because it recognizes, it says, I really appreciate the invite and would like to see you too. I'm still doing my best to minimize risks right now. So it doesn't reflect anything on the other person's choices about whatever it is they're inviting you to do. It recognizes that in this case, you're expressing that, yeah, please still invite me because I want to know what's going on or keep up. But it also, for me, I like a script like this because it doesn't require me to go into the whole thing about, because of my OI, I'm very high risk. I feel like that kind of triggers for me that vulnerability piece that Dr. Fynan mentioned as well. And so for my own coping, I don't need to repeat that 100 times. I can keep it pretty short and to the point. And lastly, just a note on kids with COVID, recognizing that their ongoing stressors with this are similar, but not exactly the same as ours. We're making all these decisions for them, which can be really hard, especially for those tween ages where just a few months ago, we were likely putting more decisions in their court than they have right now. Now they're basically being told what they are and what they aren't doing in many cases. Consider as this new school year starts, which, believe me, it brings its own challenges. Consider that in many schools, they are offering some unique or some new or just new this year, school-based resources for mental health. So I would really advise you to check into those. I know our family is doing that. Our virtual schools have partnered with children's hospitals to offer some telehealth services. So check those out if your district has them. If they don't, maybe suggest them. In our case, the partnership doesn't cost the district any money. It's just kind of a connection, a bridge. And that whenever, your family begins more of a reentry process, that will be different for each of us, that will bring its own challenges. There's going to be different forms of anxiety around all of this. I think we talked a little bit in March how it's been interesting that I haven't been in large groups in months, and I haven't been, shopping in places. So things like staring and questions from strangers are going to seem different maybe than they did when you've had a break from them for months. So that's something to consider for kids with OI as well. Or kids and families of people with OI. And last, just a couple of quick resources that our family has checked out. Books on COVID, I think, are great for kids to open this conversation, and there are some good ones that have made their way to the market. We have these two, Lucy's Mask and Verona the Corona. I like both for different reasons. And then there are a few apps, and these carried over that some of us were using these in the prior call, but a new one is called COVID Coach, and it is free. It's the one pictured here, and I do like it. It has like a mood check and some nice tips and resources and things. So there might be other ones too, and I'd encourage you to drop them in the chat box if you want to share some resources that you found helpful through this. And I would also encourage you to drop your questions in the chat box. I know we're really looking forward to talking through issues that are important to you, and we had hoped this would be a Q&A session. So I will leave it at that and look forward to your questions. Thanks. And I'm going to stop sharing my screen, but there's my contact information. Okay.
Thank you so much, Dr. Ayers and Dr. Fynan. That was really, really insightful, even for me too. We do have a couple questions that came in before the meeting today. But again, as Dr. Ayers suggested, if you have any questions, please feel free to put them in the chat and we will add them to our list of questions. I think the first one is, do either of you have any advice for coping with stress or anxiety during the pandemic? I know you mentioned the app, the books, but if there's anything like that you have found that has worked or that you would advise people that they could do real quick and easy at home.
I can kick that one off just as someone who is navigating the whole anxiety thing myself. Always a good time, right? For me, one of my favorite tools to use, aside from just different deep breathing techniques, because I don't know about you, but I notice that I tend to hold my breath when I'm doing things that make me nervous, even if that's just as simple as walking. That could even be like a pain response too, where we're like holding it all in, and we're often not doing the deep, really good diaphragmatic breathing. So that's one that I definitely lean on myself if I'm noticing that I'm doing a lot of just shallow breathing, because you'll feel pretty, relatively instant results because you're finally breathing. Imagine that. So that's something that I really like. And then if you have negative thoughts coming in, our thoughts can really affect how we feel. Sometimes those are not even really at a conscious level. So I'd invite you all to kind of tune in to what tapes you allow yourself to play when it comes to just your thoughts, because we often just let them kind of play and loop, and we don't really do anything to stop them when they're negative. So I'd invite you to try stopping that tape, maybe even thinking of like a new one that you can put in there. So if a negative thought is that you're stuck at home, just a reframe would be looking at all of the decisions that you're making that are positively affecting your health. That your health is being a priority when you're deciding to stay at home. And it's a difficult decision to make sometimes, but you do get benefits out of it, like Dr. Ayers was saying. So really leaning on those benefits and then weighing the pros and cons of what might be needed for my mental health in that moment so that I can get the benefit.
I agree. I think those are great strategies. I also was reading an interesting piece of research that was discussing how and this was in relation to quarantine fatigue, but it was about finding that balance between distraction, but something that's stimulating too. And so it was pointing out how and I just saw something come into the chat too, in terms of taking in more news, and kind of, we've seen this term emerge during this time called doom scrolling. And so it was addressing how that the reason that doom scrolling and kind of taking in more and more news isn't helping curb our depression and anxiety kind of symptoms at this time is because it's really not stimulating enough for our brain. So you have to find this mix between finding something that's distracting for you, but that is also stimulating. So, and it doesn't have to be like, calculus stimulating. So you can find, I don't know. So for me, I've tried to like tune into audiobooks or podcasts instead of just the incessant scrolling. And I think it really is being insightful too about what those tapes that are playing, as you mentioned, and what are they saying. I know for me, sometimes it can look like insomnia too. I mean, I can be completely irrational at night with my thoughts about anxiety related to all of this and what it's going to mean when. And so thought stopping can be helpful too, especially if it's like 3 a.m. So just actually envisioning whatever it may be, a stop sign. Sometimes they pick like wild animals, and you actually focus on that image to just stop this runaway train that your thoughts have, because in certain situations, like 3 a.m., it's you may not be able to invest the energy to reframe and think about something more positive. You really just need to stop the runaway train. So hopefully that's a little bit helpful.
Thank you both. A follow-up to that question is, any advice for helping a child deal with anxiety?
Yeah, I can start this one. I think there are some great tools, but what may be most helpful is that if it is a joint effort, so getting the child's buy-in. There are some really good books out there. Again, I know I'm a big children's literature fan of walking these issues walking through these issues together as a family, but it really helps kind of to tell a story and then to open these paths to discussion. So there are some good books that address anxiety directly, talk about it, give a word to it. With kids, we always say you got to name it to tame it. So you got to have names for your feelings, and anxiety can look a lot of different ways. So in kids, it may look like a stomach ache, it may look like being grumpy, it may look like being irritated. So you can talk about how all of those things, can relate to anxiety and what are the sources of anxiety. Sometimes we look for this like one magic source, and it more likely is contributing factors, but there are some cool things that you can do together as a family. Thinking of one, like there's a like a stress little jar that you can make with things that most of us have at home with glitter, that you turn it over and you breathe deeply, as Dr. Fynan talked about, and you watch the glitter settle. And it's not so much that there's magic in that glitter settling, but the whole process of talking about it, making it together, and practicing that coping skill can be helpful for kids.
Definitely. We have our own little glitter jar here at home, which I love. All things glitter, always. But I think another thing that is important in just helping our children with anxiety is that sometimes we feel like maybe we aren't like, oh, I'm having anxiety. How could I possibly help them out if I'm feeling all of this too? And maybe I won't know what to say. And maybe even just that is adding to your anxiety. But so often it really isn't about knowing the right thing to say as it is to be listening, and to really just provide an opportunity for them to be heard. And because that creates like a feeling of safety, like knowing that they're being heard and that their feelings are being heard, and that they're being listened to. So I think that that is a really good space to start with too.
Great, thank you. So now the next question is, do you have any suggestions for affordable or free mental health resources?
I can take a look as far as free ones. I know that I posted some on my own Facebook, and I don't know it off the top of my head, but there are free resources available. There may be even resources through your company's, through your company if you're working. I also mentioned Psychology Today, and I would encourage anybody to go on there because there is a really great search engine for therapists where you're able to select, you know, what insurance do they accept? Are they on a sliding fee scale? Do they have free or pro bono counseling that they offer? Some local universities might have that, or if you're interested in seeing a registered intern, they may provide free or low cost counseling, and they're working under the supervision of a licensed therapist. So that is an option. So, you know, I would just encourage everyone to look at that, and also to know that there are crisis hotlines that you can always reach out to. Sometimes we hear the word crisis and it's like, oh, well, I'm not really like in crisis, but if you really just need someone to talk to, then that would be a really great place to start. You can reach them through text now. There's also a lot of apps that are available where you can be talking to a live person. So, you know, a quick search, even just on Google, like mental health apps or free therapy, might get you a lot of information. So I would definitely start there.
Yeah, I would too. And EAP might be what your employer calls it for counseling. And I have noticed an uptick in the app-based paid counseling services, and I haven't tried those, and I don't know much yet. I think we'll see now that there's more use of those, kind of their effectiveness. But some of those can be higher priced than even the sliding scale fees that Dr. Fynan mentioned. So if you're thinking about going that route, but you see that price, I think the last one I checked was like $125 a month. Then check your sliding fees first, especially in your area, because many providers are still offering telehealth as an option. So if the kind of remote option is what you want, but you are looking for a affordable price that's covered by your insurance, you may be able to find that.
I think Melissa is frozen, and we're having a bad storm here in the DC area, so I don't know if maybe she's gone. I don't know.
Oh, I can't hear your
you have
thunder,
access. Yeah. Do you have access to the questions?
Yeah, I do.
And I can jump in too, actually, if we need some help.
Great, thanks, Michael.
No problem. So,
Oh, I saw one in the chat box that I could answer if you want me to start with
absolutely, yeah.
that. Okay.
Yeah, thank you
Okay.
everyone for being patient with us, you know, the
Yeah,
magic of live TV, right?
exactly. So Jess Wallace in the chat box was saying, how do you approach a friend that frequently unloads their COVID anxiety onto you? We're already learning how to process our own anxiety, then to try to provide support for someone else at that time can be incredibly overwhelming and stressful. And I think that that is a very relatable question for all of us. And I can relate to that too, for sure, where we, you know, sometimes just have people that reach out to us, but maybe it's starting to be a little bit more consistent where it's not really a give and take, and it does feel, like she said, an unloading. And this is where boundaries can be really important. And then also just, you know, having those scripts that Dr. Ayers was talking about, like we could even brainstorm a script together today that would be helpful. So for example, if I had somebody that was consistently reaching out, like I would want to start by just letting them know that I heard them. So I would say like, yes, I definitely understand what you feel. If that was something that resonated with you, of course, you know, like, yeah, I'm totally feeling that. In fact, today I'm having a hard day when it comes to all of this COVID stuff. So maybe we can each work on something that will be helpful, but I don't think talking about it will really help, that I could be, you know, really helpful with talking about it right now. Maybe we can check back and then talk about like another time that works for you, or provide them with something that you're working on that's helping you, because then you're, you know, you're assisting them, but you're also setting a boundary of, I'm not just always available to talk about this, you know. So you're sharing your truth, you're setting a boundary, and you're providing a resource. And I think that that could be, and by practicing that, that could be helpful. Also knowing that we don't have to respond to every single thing that we get. You don't have to. And I know that sometimes we feel guilty if we don't respond. So maybe coming up with a script for when you don't plan on respond. Hey, I'm busy right now. Can I catch you in a minute? It could be some, or not a minute, but like a couple days. But it could be something that works for you. And just knowing that you can do that, and that's okay. I think that's important too.
Great, thank you.
Great.
Yep.
Dr. Ayers and Dr. Fynan, I just wanted to let you know that Dr. Sandhouse has joined the call too.
Yeah.
And many of you know Dr. Sandhouse if you need him to jump in. So just wanted to let you know that.
I feel like I'm like everyone is doing a great job. I don't know what I would add.
Well, I thought of one thing you could add if you were willing. You know, just my individual, totally personal opinion is that one of the safer places I have felt going has been to a couple of medical appointments that my son or myself have had. He actually had to have surgery a couple days ago, so we were really nervous about what that would be with COVID, but we felt like that the response, you know, in medical settings is pretty trustworthy, consistently masked and distanced. And so for me, I'm considering kind of making some of those appointments that I have had pushed off. And I just wondered, I know, you know, you're not here to give medical recommendations, but if you wanted to give your perspective on that, or any kind of updates you have to share on the
Sure.
health side.
I think that's a great question. I think that, you know, if physicians put themselves at risk as part of this, you know, pandemic. That's what we do. I mean, that's what we do all the time. And this has just sort of emphasized that. But corresponding to that, they want to do everything possible to avoid risks to their patients. And so most medical centers and physicians' offices have gone to extraordinary steps to maintain the safety of patients that need care in their facilities. But the easiest thing to do, and the thing that will give you the greatest reassurance, is actually calling and saying, what steps have you guys taken when you're making an appointment? Have you guys taken to ensure my safety before I, consider coming in for something that's more routine? Um, and most physicians, most centers will describe in detail the things that they're doing to maintain safety, or will say, we're in a practice that takes care of a lot of COVID patients, and we don't have the ability to maintain that safety. And maybe they'll say where that person should go. Just as an example, in my facility, we have separate entrances for people who are coming in because they have COVID-like symptoms or are being followed up for COVID infections. We have my center sees a lot of out-of-state patients, and we have a whole testing regimen that patients coming in from out of state have to be tested, within 3 days of leaving their home location, and then they get tested again before they enter the hospital. We have the luxury of homegrown, extremely rapid testing, so a patient only has to wait about 10 minutes to get their test results while they're waiting outside the facility in a nice, comfortable area. Everyone, both staff, physicians, and patients, goes through the usual screening questionnaires and these temperature taking kiosks. And those are scattered throughout the hospital. So you're constantly passing kiosks that are telling you normal temperature, normal temperature. And and for facilities that are primarily catering to people not because of COVID, but because of other medical conditions, we have entirely separate entrances and entirely separate staff, where we can say that our staff that takes care of this, clinic has not seen a COVID patient in the last week, whether it's nurses or aides or receptionists and things like that. We have the luxury of separate buildings and things like that. It's kind of a medical campus. But even the local physician's office, I've gone to my local physician's visit, and they were doing pretty dramatic things. They never had more than 2 people in a waiting room at a time. They all do testing of staff and put that on the wall, 5 days, no positive cases among our staff, and things along those lines. So that's a long way of saying the best thing to do is call ahead.
Yeah, thank you so much.
Great, thank you. Dr. Sandhouse, and actually, while we've got you, we've gotten a couple more questions, kind of more targeted for you, if you don't mind.
Okay.
So
I hope I didn't interrupt a discussion that was really going well on these health issues, mental health issues. I would very much enjoyed the answers you guys are giving.
Thank you. No, thank you for being here.
Go ahead, Michael.
So, and I have actually, you and I have talked a fair amount on some of these issues as well. So I know some of this is kind of repeating things we've already discussed, but for
then I might know the answers.
Yes, exactly. So one is simply, is it safe to get surgery these days?
Yeah.
And what should be your thought process for that?
Well, a lot depends on what, I think if it's a facelift, you can probably postpone. It really depends on what the surgery is for. If it's a condition that's, bothering you or needs needs a procedure for your health, most surgical centers, much like what I was saying, have very nice precautions for patients with to protect them against COVID-19. No anesthesiologist wants to intubate a patient to give general anesthesia without having that testing and security in place, because that's been the major source of infection of healthcare personnel, is doing procedures that involve the airways, and anesthesia involves the airways and can spray virus into the air if that's used, if the patient happens to have an infection and doesn't know it. But the same thing is true for the staff. The staff all have to go through questionnaires daily, have to have temperature taken. They have to have not, in most surgical centers, they have to have not been involved in the care of patients with COVID. And in general, centers reserve operating rooms for non-COVID patients versus COVID patients. Even so, they clean the operating room more than usual between patients, although operating rooms tend to be very clean environments to begin with lots of cleaning going on. So it really depends on whether the surgery that you are considering is something where the delay will not harm you, in which case the safest thing is delay. But if the approach is, if the surgery is something that is going to help your health and stuff, I wouldn't delay it. I'd simply do the same thing as I recommended: call ahead of time, discuss with them what the issues are, and should be easily taken care of. Really depends.
Michael?
I also want to say that you have to temper those answers by considering what the local infectivity is in your area. If you're in a high infection rate locality, and especially if it's on the rise, you might want to delay a little for something like a surgical procedure that isn't emergent. But if you're in an area that has low prevalence of COVID infections and a falling infection rate, you can be a little more reassured.
Michael, Laura Tosi,
Hey,
I
Laura.
want to underscore that. Me through okay?
Yep.
Yeah.
Yep. Since I do pediatric ortho, we can't turn off our surgeries because children tend to break a lot. And I just want to reassure parents on the call that certainly my hospital, and I think every other children's hospital that I'm aware of, has really stepped up to ensure that we can take the best possible care of these kiddos. And just as Dr. Sandhouse was saying, we have separate ORs for the COVID positive patients, the anesthesia could not be more attentive to patients, both pre-op, peri-op, post-op. Needless to say, I agree, no facelifts right now. But if you need something done, the American surgical system is there to take care of you, and it's working.
Clearly, I won't even go to a barber.
Good point.
Great. Thank you both so much. Those are really important, essential insights you're providing. I want to ask, so it sounds like both of your institutions are, doing procedures that are going above and beyond. For people that aren't going to your two hospital systems, are there like essential questions or that people should be thinking, should be asking their doctors before they arrive?
If you go to almost every center and physician's office has a website, and I will bet you that if you go to their website, the very first thing that they'll show you is all the things that they're doing to keep their patients safe. So one easy thing to do is to head to your doctor or your facility's website and see what they put down in writing that they're doing, and then I just emphasize the best thing to do then is call, and don't be shy about asking what exactly will you be doing to keep me safe from COVID when I come to your facility. I'm sure they'd like to brag about what they're doing because they've worked hard at it.
Mhm. Gotcha. Thank you.
It really, I thought I just add, I think this experience for me has, you know, I knew that I was a decent advocate for myself, my family before, but this has really put us to the test in terms of being assertive about your own needs and your own safety. And that can feel really uncomfortable at different times. But I think looking back also, I've gotten better at it with practice. So, and I mean, I think many of us, I know I've called, if it's a smaller clinic like or a dentist or something like that, I've had to make similar calls to ask if they have steps to go to the office or if they have a electronic exam table that lowers so that I can get on. So it hasn't all been new to me, but I have had to be much more assertive about it. And sometimes that can be anxiety provoking in itself. But again, just reminding ourselves of what our end goal is, which is maintaining our health through all this.
Well, the other thing to add is you should be sure to remind your care provider or tell them if they don't know that you have OI and that the Medical Advisory Council of the OI Foundation has evaluated the evaluated the risks and believes that OI patients are at greater risk of developing severe complications should they develop COVID. And it's very important that steps be put in place with that in mind.
Thank you. Yeah, and I so appreciate, you know, Dr. Tosi, Dr. Sandhouse, you both sharing those insights, because part of alleviating the anxiety is just feeling prepared with what to say when you're calling, and just, you know, knowing that, you know, we are at a higher risk, and just having that reminder of like, oh, I should say this as I'm calling, because that might not be top of mind when I'm making my phone calls ahead of time, and feeling prepared just really can help with that. So thank you so much for chiming in today.
My pleasure.
Great. Thank you all so much. So we're getting a few more questions here into the chat. And also there's sort of a combo now of COVID-related questions and also mental health questions. So I want to, while we still have Dr. Tosi and Dr. Sandhouse with us, talk a little bit more about some COVID questions, but all of you, please chime in. So do we have any data about OI and COVID-19? And I know this is a question the foundation gets a lot. So Dr. Tosi, Dr. Sandhouse, but basically we're asking about, do we know of anyone who has had COVID, people who have survived? Do we have any more information or an update we can provide?
Tracy, do you have data from the OI Foundation?
I'm sorry, I have a very unstable connection. I think it's storming outside. But there are wonderful people, I think, on this call, and I hope they will participate in our COVID survey. As part of the foundation's registry, we have been gathering information about what the community is experiencing.
Oh, that broke up a little, Laura.
Yeah. So to everyone on the call, so the OI Foundation is based in the Maryland area, and a big thunderstorm is rolling through. So if you've noticed, the OI staff has cycled through because a bunch of us have, I think, lost internet connection in the last hour. So don't be alarmed if you just see one of us blip off. Just normal summer weather.
I can tell you that I also work with another rare genetic disease community that has lung issues as part of its component. And we have surveyed every month 7,000 of our patient community members who agree to answer questions on a monthly basis. And we've confirmed, we have the same recommendations to them that our Medical Advisory Council in OI has for our patients. And that is that, to the best of our understanding so far, we don't believe that OI patients are at greater risk of becoming infected. There's nothing about OI that would make you more susceptible to becoming infected. But we do believe, because of the kind of hidden respiratory issues that OI patients can have, that they are likely, if they do get infected, to have more clinical symptoms and perhaps be more likely to have severe disease than the general population. And in our group, in the other organization I work with, we've actually confirmed that over the course of the last several months. In fact, the number of people in that community who've become infected is less than the national average of people who got infected. And we think that's because they take better care of themselves. They protect themselves more because they understand the risks. But of those who got infected, about 50% of them wound up in the hospital for treatment for their COVID, which is much higher than the general population. And it kind of confirms our initially what were only expert opinions. We now have data to back that up. And that's what the OI Foundation is hoping to glean from the questionnaires that are being filled out by people now in the OI community. Are you back, Laura? Every now and then I see your head move.
Yeah. And
then
Dr.
freeze.
Tosi, it may help if you turn off your video camera and just do audio.
I think she's gone.
Oh, okay, well, she'll, when she joins us in a minute, we'll have.
I have beautiful weather here in Denver.
Very jealous. So we still have plenty of things, and I'm actually gonna direct this question more to Michelle and Kara. So someone put in a comment about emotional resiliency and talking about how, particularly as this pandemic moves on, this concept that like we're less able to cope with things that come up in our life. We're more impatient, at least, and I saw this comment and I was like, oh man, I am going back to a phone call I had with my parents just a few days ago. I was like, fine, bye. You know, and it felt
well, I know
very
your parents.
universal. And Dr. Sandhouse has met my parents, so he's being very nice. You know, just this concept of, you know, how do you deal with this resiliency problem, and also how do you build it back up?
Yeah, so it's almost as if we have this cup that is being filled by all of the different things that are going on, and our cup is pretty full right now, and it does not take a lot for it to overflow. So there are, you know, different things that we need to be practicing on a regular basis. And I say practice because it's maybe not something that comes naturally. It might even feel a little bit difficult at times to be putting these tools and techniques to work, because if we go long enough without doing them, they're not like a regular thing for us to initially do. Like, oh, I'm not feeling great, let me use all of my tools that I have, and guilty as charged, you know, that sometimes we're not recognizing that our cup is really ready to overflow. And that can kind of go back to what I was talking about, where if we are out of touch with our body for so long, we're not really listening to it. So in the same way that our kids need us to listen to them, we also need to really listen to what our body is telling us, because we often ignore it and then it's too late. Like we're at that point and then we're exploding, right? And then we've got consequences to deal with after that. So kind of being mindful and taking the time to check in with yourself, not just with yourself emotionally, but also physically, like how am I feeling? And then doing things that help with that, like self-care is very important. What are things, and it's going to look different for everyone, what can you do to specifically fill your cup? Is it talking to people? Is it talking to less people? Is it, you know, really eliminating the amount of media that you're taking in? Is it taking a nap when you really need it? Maybe, you know, and I would encourage you to talk to those around you and find out what they're doing and what helps them, because they might be doing something that really would resonate with you, but you're not doing it. And then also, I would encourage you to do it. And I'm saying that to myself as well. So I invite you to join me on this journey of actually using the tools that maybe you're aware of. And have an accountability partner that can really be a good way of, you know, building back that emotional resiliency. And we're a resilient crew, you know, and we are doing a lot of things really well. And I think those things get clouded when we're feeling so much tension. So kind of reflecting back on that, I think, can be helpful as well.
I do too, and just validating with yourself that in the same way that, you know, we come to understand that certain parts of OI are normal for us or typical or expected. I mean, this response right now is also expected and normal, and we're caught in this weird in-between because we've lost kind of like the flashy newness of it, but yet we're not quite, we haven't gone through enough time yet to where we can really establish habits, which could give us kind of a sense of stability and less uncertainty. So we're in this like awkward in-between phase where some of the things that we, you know, we're kind of celebrating that were gone from our life in March, thinking of things like maybe working in the office or your commutes home. I know that was one for me. I was like, I'm saving all this time, not sitting in traffic. But sometimes we don't realize that those parts of our day that were habits provided some stability and some comfort in themselves, and also provided a buffer in some cases. I never like to sit in traffic, but at the same time, it provided a little bit of buffer for me between work life and then walking into family life with 3 kids. So now I have no buffer. They're, you know, right on the other side of the door, sometimes in here with me. So we've lost buffers along the way. And this idea of grief is also one that I've found helpful to explore. And there's lots written and some good podcasts and things out there about this kind of, some people have different terminology for it, like low-key grief, or, you know, even if you haven't had someone personally that has been impacted by COVID, the losses that we have felt are real. And so we need to give ourselves some grace and space to build back that resilience and just recognize that what we're experiencing right now is typical and okay. Ambiguous losses. Yeah. Thank you, Leslie.
Great, thank you so much. I am seeing a question here talking about, and Michelle, I see you had brought up as well in the comments about specific numbers and outcomes related to OI and COVID-19. Unfortunately, I personally do not have that information. Part of it is that I believe through this survey we're trying to do, we are trying to collect that info, and it is changing. It is not like a static number. It's not like we know 5 people with OI, like it is changing day to day. So I unfortunately cannot give numbers nor solid outcomes. If I had information, I would share it. Dr. Sandhouse or Dr. Tosi, if you're still online, if you want to contribute to that answer. I just didn't want to come across as avoiding the question. We didn't answer because I personally do not know.
And neither do I. So my suspicion is that it's not something that's being looked at in real time. But the information, they're still in the information gathering phase.
Yeah.
Also, Michael, I did notice a few, like way back up, there were just a few questions that were addressing, how do I find a therapist that maybe does telehealth, that has this understanding of trauma or has worked with someone with disabilities? And I saw someone mention even just a therapist who doesn't have like ableist, feelings about things. And I think it's so important to be able to find a therapist who is aware or even specializes in working with people with disabilities and medical trauma. That's certainly something that people do specialize in. So I'd encourage you to look into that in your area. One great way to find someone is to also check in with your support group. If you go to an OI, if you have an OI support group in your area, that's how we usually share our doctors who are great with working with us too, that are in the area. So that would be a really great place to check in and just say, hey, is anyone seeing a therapist that, you know, has some understanding of just medical trauma and disability and how that overall can affect trauma and just experiences in general. So that could be one way to do it. And then even looking outside of your group, just if you have friends that have other disabilities, or even just finding different groups on Facebook of people like that you can get support from who have disabilities and see who they might talk to. So the therapist that you go to doesn't necessarily have to have OI or even really know what OI is to understand how medical trauma can be a concern. So I hope that that's encouraging as well. Therapists are kind of limited to where they can practice based on where their licensure is. So for example, I'm licensed just for the state of Florida. I believe, is that how it, and for you, Kara, you're Ohio?
Yeah, I actually don't see patients at this time, but it's a challenge that I've also worked with the American Psychological Association. And one of our subcommittees is working on creating some type of a document that would help people answer that very question. How do I find an anti-ableist therapist? In the same way that other groups want to find a therapist that will at least in some way not, you know, counter a piece of their identity, that what questions do you ask upon, you know, trying to make the connection? What kinds of things can you look for in a bio of a therapist that usually is on a website? So that is trying to be pulled together, because we see this question a lot, like, okay, I want a therapist and I want to look for this match for me, but how do I even begin that process? It's hard, but not impossible.
For physicians, you know that the CMS and the FDA have sort of had a waiver put in place for having to have medical license in the state that you're calling for telemedicine visits. And I wonder if there's anything in the works for similar kind of licensure for people in fields like psychology and stuff like that.
Yeah, I'm sure that there's some sort of a COVID clause that we might be able to be going, working with. So that's definitely something to look into.
Great. So I want to thank you all for joining us today. And before we log off, do you have any final words you'd like to share with our group?
Yeah, mine are pretty short and sweet. You know, I think as we have seen a lot of divisiveness across this, I have felt anchored by the fact that largely our OI community is still in this together. And that doesn't mean we all have to think the same way or make the same choices, but we're learning as we go. We can apply skills that we already have. We can build on them. You know, I'm still trying to remember what I shared in March, which was trying to enjoy the little things that this is bringing to us. And really, like Dr. Fynan said, let's use those skills that we talk about and remember to actually put them in place in our life. And everybody hang in there. That's kind of been my mantra. All the meetings I come on to, everybody says, how are you doing? And I say, I'm hanging in there. And that's really all we can expect of ourselves right now.
Yes. And, you know, like I said before, I invite you to be accountability partners. I know that we all need that. We're all in this together. And on one of your slides, Dr. Ayers, it said we can do hard things. And I think as people with OI, we've certainly done many hard things, and we continue to do hard things. And this is one of them. And I think that just moving forward, we just need to continue to show up as a community in support of one another. I'd encourage you to reach out to both of us and just the OI Foundation in general, so that we can continue to just provide that support. And I thank you so much for everyone who was able to make it live, and for everyone who catches this on a replay. Thanks for having us.
Thank you all so much. Have a good day. Have a good week. please stay safe and stay healthy, and hopefully we will see you soon.
Yeah, thank you.
Thanks a lot for
Thanks,
letting
everyone.
me participate.
See you. Thank you.
Yes, thank you.